The holidays for many is a time to enjoy family, friends, enjoy delicious holiday meals and delicious pies and pastries. Between the leftover Halloween candy and holiday sweets, all this sugar intake may be doing more harm than good, especially if you're diabetic and don't even know it. Whitney joins us, and she recently got checked for this disease, and she's going to tell us about her experience. How was it, Whitney?
Well, Megan, it actually was not as bad as I thought it was going to be. I was scared out of my mind, but after learning so much about it and talking with healthcare professionals and those who have been diagnosed and are living with diabetes, it's actually motivated me to make some lifestyle changes.
It takes about 10 years to evolve into a diabetic, and so there's things that can be warning signs.
Those signs could save you years of complications if you make the right changes at an early stage.
It's not how many people are going to be diabetic, it's how many people are pre-diabetic. We probably have at least 65 million people that are pre-diabetic.
So what does pre-diabetic mean? I went to Alaska Regional Hospital to find out.
We want you to be diagnosed when we can help you. We don't want you to have a heart attack. We don't want that call saying, I thought I had the flu, but I had diabetes.
I've had a history of diabetes in my family. My dad and cousin is diagnosed, and diabetes runs on my mother's side. I needed to know more about it and find out if I was at risk or living undiagnosed. Oh, so how many people do you do this to all the time?
Okay.
I was given a hemoglobin A1C test that measures my 3-month average blood sugar.
That didn't hurt at all.
The higher the number in your A1C, the higher your blood sugars are running on a daily basis.
It was just a quick poke, and 5 minutes later, I got my results. My score was 5.5. Dr. Tanner says my score shows that I need to be careful. A healthy A1C, according to the Anchorage Neighborhood Health Center, is between 5.0 and 6. 7.0 and higher means damage is being done and further tests should be taken.
Well, when you're screened, your numbers may be good today. We tell you to know the signs and symptoms of diabetes, and if something changes, go back to the doctor.
Experts say prevention is key, and an annual physical can keep you up to date on your status.
Being diagnosed is actually good news. It means because you can get on a program with your doctor.
Dr. Tanner says it's important to make lifestyle changes immediately and treat your diagnosis as if it's your first heart attack.
All it means is we're going to have a lot more people having heart failure, a lot more people having heart attacks, a lot more people having dialysis and strokes. That's what it means if we don't get a hold of this as a society.
According to the Center for Disease Control, by the year 2050, 1 in 3 Americans will have the disease. The majority will be diagnosed with type 2, caused by a lifestyle that makes our bodies insulin resistant.
The type 2 is growing because most people in our society are overfed, undernourished, and underexercised.
A good rule of thumb is eat less, move more, and many things in moderation.
Age, ethnicity, and family history are some other major risk factors. Dr. Tanner reminded me that since you don't have control over those things, then a change in lifestyle can definitely prolong the onset of the disease, and it's possible you could forestall it for good.
All right, thank you, Whitney. That's Whitney Miller reporting for us tonight. Still ahead.